Hey there, future doctors! Today I'm going to show you how to collect blood specimens like a pro. Let's dive in. First things first, make sure your patient is comfy in the phlebotomy chair. Always double-check their details against the request form. It's crucial. Next, inform your patient about the test. Ask if they've had blood tests before and if they've ever had any reactions. If they have, get in touch with your supervising medical officer or pathologist. Now, on to the paperwork. Go through the request form thoroughly. Make sure you prepare and label all the containers correctly before starting. If you're unsure about anything, don't hesitate to ask a senior colleague or refer to the test list. Choosing the right equipment is key. Pick a syringe that can get the necessary blood amount in one go. If you need multiple samples or more than 15 milliliters, use a butterfly needle or cannula. Time to find the perfect vein. Opt for the antecubital vein on the forearm if possible. Clean the area with a 70% alcohol swab, scrubbing vigorously. If it's for a blood culture, you'll need to sterilize it with iodine and then remove it with alcohol. Apply a tourniquet, making sure it's tight enough to obstruct venous flow. Ask the patient to clench their fists to make the veins more visible. If you can't find a good vein on the forearm, try the dorsum of the hand. Insert the needle into the vein and draw the blood gently. Remember, don't pull too hard. It can collapse the vein and ruin the sample. Once you've got enough blood, release the tourniquet. Now, apply pressure to the puncture site with an antiseptic swab for 2-4 minutes until the bleeding stops. Only then should you let the patient move. Dispose of the swabs in designated baskets. Remove the needle from the syringe and distribute the blood into the labeled containers. If the patient feels unwell, help them lie down and give them a hot drink. If they collapse, withdraw the needle and raise their legs. If the specimen isn't drawn on the first prick, or if you're dealing with a child under 1 year, very sick patients, or special cases, inform the pathologist immediately. For serology tests, use a vacuum collection system. Collect paired specimens during acute and convalescent phases of illness. Protect the samples from heat and cold during transport, and store them at the correct temperatures. For blood cultures, consult the microbiologist for the right media. Wash your hands, wear sterile gloves, and follow the blood withdrawal procedure. Clean the culture bottle bung with iodine. Inject the blood and clean the site again afterward. And that's it. You're now ready to collect blood specimens like a pro. Practice makes perfect, so keep at it. Thanks for watching and stay tuned for more tips and tricks in your medical journey.